Question 1. A client with acute myelogenous leukemia is undergoing induction chemotherapy and develops a temperature of 38.4 degrees Celsius, 101.1 degrees Fahrenheit, absolute neutrophil count of 400 per cubic millimeter, and reports chills and malaise. The nurse notes no obvious source of infection. Which action is the nurse's priority? A. Administer acetaminophen and reassess temperature. B. Obtain blood cultures and initiate broad-spectrum IV antibiotics. C. Place the client in a negative pressure room. D. Delay treatment until infection source is identified. Answer. B. Obtain blood cultures and initiate broad-spectrum IV antibiotics. Rationale. Febrile neutropenia is an oncologic emergency. Immediate cultures and empiric broad-spectrum antibiotics must be started to prevent rapid sepsis progression. Question 2. A client receiving cisplatin chemotherapy reports tinnitus and decreased hearing acuity. Which action should the nurse take first? A. Document findings as expected side effects. B. Hold the medication and notify the healthcare provider. C. Administer antiemetics. D. Increase hydration rate. Answer. B. Hold the medication and notify the healthcare provider. Rationale. Cisplatin causes ototoxicity. Early recognition is critical to prevent irreversible hearing loss. Question 3. A client with metastatic breast cancer receiving IV chemotherapy reports burning pain and swelling at the infusion site. The nurse observes erythema and lack of blood return. What is the priority action? A. Flush the line with normal saline. B. Stop the infusion immediately. C. Apply a warm compress. D. Elevate the extremity. Answer. B. Stop the infusion immediately. Rationale. This indicates vesicant extravasation. Immediate cessation prevents severe tissue necrosis. Question 4. A client with non-Hodgkin lymphoma develops hyperkalemia, hyperphosphatemia, hypocalcemia, and elevated uric acid levels after chemotherapy. Which condition is the nurse most concerned about? A. Disseminated intravascular coagulation. B. Tumor lysis syndrome. C. Septic shock. D. Acute renal failure unrelated to treatment. Answer. B. Tumor lysis syndrome. Rationale. Rapid tumor cell destruction leads to electrolyte imbalances and kidney injury. This is a life-threatening emergency. Question 5. A client receiving radiation therapy to the neck for laryngeal cancer reports difficulty swallowing and dry mouth. Which intervention is most appropriate? A. Encourage spicy foods to stimulate saliva. B. Provide frequent oral care and saliva substitutes. C. Restrict oral intake. D. Administer diuretics. Answer. B. Provide frequent oral care and saliva substitutes. Rationale. Radiation causes mucositis and xerostomia. Supportive care prevents complications and improves comfort. Question 6. A client with multiple myeloma reports bone pain and fatigue. Laboratory results show elevated calcium levels. Which intervention should the nurse anticipate? A. Fluid restriction. B. Administration of IV bisphosphonates. C. High calcium diet. D. Bed rest only. Answer. B. Administration of IV bisphosphonates. Rationale. Hypercalcemia is common in multiple myeloma. Bisphosphonates help reduce calcium levels and bone resorption. Question 7. A client undergoing chemotherapy has a platelet count of 18,000 per millimeter cubed. Which nursing intervention is most appropriate? A. Encourage vigorous toothbrushing. B. Administer IM injections as prescribed. C. Implement bleeding precautions. D. Encourage ambulation without assistance. Answer. C. Implement bleeding precautions. Rationale: severe thrombocytopenia increases bleeding risk. Precautions are essential. Question 8. A client receiving doxorubicin therapy is being monitored for cardiotoxicity. Which assessment finding requires immediate intervention? A. Mild nausea. B. Hair loss. C. Decreased ejection fraction on echocardiogram. D. Fatigue. Answer: C. Decreased ejection fraction on echocardiogram. Rationale: doxorubicin can cause irreversible cardiomyopathy. Reduced EF is a critical finding. Question 9. A client with lung cancer develops facial swelling, distended neck veins, and dyspnea. Which condition does the nurse suspect? A. Pulmonary embolism. B. Superior vena cava syndrome. C. Pneumonia. D. Heart failure. Answer: B. Superior vena cava syndrome. Rationale: tumor compression of the SVC causes venous congestion and respiratory compromise. Question 10. A client receiving chemotherapy reports severe nausea and vomiting despite antiemetic therapy. Which medication should the nurse anticipate adding? A. Antibiotics. B. Corticosteroids. C. Anticoagulants. D. Beta blockers. Answer: B. Corticosteroids. Rationale: steroids enhance antiemetic regimens for chemotherapy-induced nausea. Question 11. A client with small cell lung carcinoma is admitted with confusion, muscle cramps, and decreased urine output. Laboratory results reveal serum sodium of 118 milliequivalents per liter, low serum osmolality, and concentrated urine. Which intervention is the nurse's priority? A. Administer hypotonic IV fluids. B. Restrict fluid intake and prepare for hypertonic saline administration. C. Encourage oral hydration. D. Administer loop diuretics immediately without restriction. Answer: B. Restrict fluid intake and prepare for hypertonic saline administration. Rationale: syndrome of inappropriate antidiuretic hormone, or SIADH, is common in small cell lung cancer. Severe hyponatremia requires fluid restriction and possible hypertonic saline to prevent neurological deterioration. Question 12. A client undergoing hematopoietic stem cell transplantation develops a diffuse maculopapular rash, diarrhea, and elevated liver enzymes. Which complication should the nurse suspect? A. Tumor lysis syndrome. B. Graft versus host disease. C. Septic shock. Or D. Anaphylaxis. Answer: B. Graft versus host disease. Rationale: GVHD occurs when donor immune cells attack host tissues, commonly affecting skin, liver, and GI tract. Question 13. A client with acute leukemia receiving combination chemotherapy develops petechiae, ecchymosis, and bleeding gums. Laboratory results show prolonged PT and APTT with decreased fibrinogen levels. Which condition is most likely? A. Heparin-induced thrombocytopenia. B. Disseminated intravascular coagulation. C. Vitamin K deficiency. Or D. Hemophilia. Answer: B. Disseminated intravascular coagulation. Rationale: leukemia can trigger DIC, characterized by widespread clotting and bleeding due to consumption of clotting factors. Question 14. A client with metastatic spinal cord compression reports new onset back pain, weakness in the lower extremities, and urinary retention. What is the nurse's priority action? A. Encourage ambulation. B. Administer prescribed analgesics only. C. Notify the healthcare provider immediately and prepare for corticosteroids. Or D. Apply heating pads. Answer: C. Notify the healthcare provider immediately and prepare for corticosteroids. Rationale: spinal cord compression is an oncological emergency requiring immediate intervention to prevent permanent paralysis. Question 15. A client receiving high-dose methotrexate therapy is prescribed leucovorin. What is the purpose of this medication? A. Enhance chemotherapy effectiveness. B. Prevent infection. C. Rescue normal cells from methotrexate toxicity. Or D. Increase urine output. Answer C. Rescue normal cells from methotrexate toxicity. Rationale: leucovorin provides folinic acid to protect healthy cells from methotrexate's toxic effects. Question 16. A client with ovarian cancer receiving paclitaxel reports numbness and tingling in the hands and feet. Which nursing action is most appropriate? A. Document as expected and continue therapy. B. Notify the provider and assess for peripheral neuropathy. C. Increase IV fluid rate. D. Administer calcium supplements. Answer B. Notify the provider and assess for peripheral neuropathy. Rationale: paclitaxel causes neurotoxicity. Early detection is important to prevent permanent nerve damage. Question 17. A client with chronic lymphocytic leukemia develops progressive fatigue, pallor, and shortness of breath. Hemoglobin is 6.8 grams per deciliter. What is the priority intervention? A. Encourage oral iron intake. B. Administer packed red blood cells. C. Initiate chemotherapy immediately. D. Provide oxygen only. Answer B. Administer packed red blood cells. Rationale: severe anemia requires transfusion to restore oxygen carrying capacity. Question 18. A client receiving bleomycin is at risk for pulmonary toxicity. Which assessment finding requires immediate attention? A. Mild fatigue. B. Dry cough and dyspnea. C. Alopecia. D. Nausea. Answer B. Dry cough and dyspnea. Rationale: bleomycin-induced pulmonary fibrosis presents with cough and dyspnea. Early detection is critical. Question 19. A client with head and neck cancer develops severe oral mucosis. Which intervention is most appropriate? A. Use alcohol-based mouthwash. B. Encourage frequent saline rinses and soft diet. C. Restrict oral intake completely. D. Provide acidic foods. Answer B. Encourage frequent saline rinses and soft diet. Rationale: gentle oral care reduces pain and prevents infection. Irritants should be avoided. Question 20. A client with cancer is receiving total parenteral nutrition, TPN, and develops fever and hyperglycemia. Which complication should the nurse suspect? A. Tumor progression. B. Central line associated bloodstream infection. C. Electrolyte imbalance only. D. Dehydration. Answer B. Central line associated bloodstream infection. Rationale: TPN via central lines increases infection risk. Fever and hyperglycemia are common indicators. Question 21. A client with acute promyelocytic leukemia, APL, is receiving all-trans retinoic acid, ATRA, and suddenly develops fever, weight gain, dyspnea, and pulmonary infiltrates on chest X-ray. Which complication does the nurse suspect? A. Tumor lysis syndrome. B. Differentiation syndrome. C. Septic shock. D. Acute respiratory distress syndrome unrelated to therapy. Answer B. Differentiation syndrome. Rationale: ATRA can trigger differentiation syndrome characterized by capillary leak, respiratory distress, and systemic inflammation. This is a medical emergency. Question 22. A client with pancreatic cancer reports persistent epigastric pain radiating to the back and unrelieved by opioids. Which intervention should the nurse anticipate? A. Discontinuation of analgesics. B. Celiac plexus nerve block. C. Initiation of antibiotics. D. High-fat diet. Answer: B. Celiac plexus nerve block. Rationale: pancreatic cancer pain is often severe and refractory. Nerve blocks provide effective pain relief. Question 23. A client receiving cyclophosphamide develops hematuria and dysuria. Which medication should the nurse anticipate administering? A. Leucovorin. B. Mesna. C. Filgrastim. D. Allopurinol. Answer: B. Mesna. Rationale: cyclophosphamide can cause hemorrhagic cystitis. Mesna binds toxic metabolites to protect the bladder. Question 24. A client with metastatic cancer develops sudden onset dyspnea, tachycardia, and pleuritic chest pain. Oxygen saturation is 86% on room air. Which action is the nurse's priority? A. Administer oral analgesics. B. Encourage deep breathing exercises. C. Initiate oxygen therapy and notify the provider. D. Place the client in Trendelenburg position. Answer: C. Initiate oxygen therapy and notify the provider. Rationale: findings suggest pulmonary embolism, a life-threatening complication requiring immediate oxygen and intervention. Question 25. A client undergoing radiation therapy for pelvic cancer reports diarrhea and abdominal cramping. Which dietary modification is most appropriate? A. High-fiber diet. B. Low-residue diet. C. High-fat diet. D. Increased dairy intake. Answer: B. Low-residue diet. Rationale: radiation enteritis is managed with low-residue diets to reduce bowel irritation. Question 26. A client receiving immunotherapy with checkpoint inhibitors develops severe diarrhea, abdominal pain, and blood in stool. Which complication should the nurse suspect? A. Infection only. B. Immune-mediated colitis. C. Tumor progression. D. Irritable bowel syndrome. Answer: B. Immune-mediated colitis. Rationale: immunotherapy can trigger autoimmune toxicities, including colitis, which can become life-threatening. Question 27. A client with advanced cancer is experiencing cachexia and anorexia. Which intervention is most appropriate? A. Force large meals. B. Provide small, high-calorie, frequent meals. C. Restrict caloric intake. D. Eliminate protein intake. Answer: B. Provide small, high-calorie, frequent meals. Rationale: cachexia is managed with nutritional support focusing on calorie-dense, manageable portions. Question 28. A client receiving vincristine reports constipation and abdominal distension. Which complication should the nurse monitor for? A. Diarrhea. B. Paralytic ileus. C. Gastritis. D. Pancreatitis. Answer: B. Paralytic ileus. Rationale: vincristine causes neurotoxicity affecting bowel motility, leading to ileus. Question 29. A client with brain metastases develops sudden headache, vomiting, and decreased level of consciousness. Which intervention is the nurse's priority? A. Administer IV corticosteroids. B. Encourage oral fluids. C. Place the client flat. D. Delay intervention for imaging. Answer: A. Administer IV corticosteroids. Rationale: symptoms indicate increased intracranial pressure. Steroids reduce cerebral edema rapidly. Question 30. A client undergoing chemotherapy has an absolute neutrophil count of 300 per millimeter cubed. Which food choice indicates the need for further teaching? A. Well-cooked chicken. B. Pasteurized milk. C. Fresh raw salad. D. Canned soup. Answer: C. Fresh raw salad. Rationale: Neutropenic clients must avoid raw foods due to infection risk. Question 31. A client with advanced prostate cancer presents with severe bone pain, confusion, polyuria, and constipation. Laboratory findings reveal a serum calcium level of 14.2 milligrams per deciliter. Which intervention is the nurse's priority? A. Initiate fluid restriction. B. Administer IV normal saline and loop diuretics as prescribed. C. Encourage calcium-rich foods. D. Place the client on strict bed rest only. Answer. B. Administer IV normal saline and loop diuretics as prescribed. Rationale. Severe hypercalcemia is life-threatening. Aggressive hydration followed by diuretics promotes calcium excretion and prevents cardiac and neurologic complications. Question 32. A client receiving chemotherapy develops a fever, hypotension, tachycardia, and altered mental status. Blood cultures are pending. Which action is the nurse's priority? A. Wait for culture results before treatment. B. Administer broad-spectrum IV antibiotics immediately. C. Provide oral fluids. D. Monitor vital signs every 4 hours. Answer. B. Administer broad-spectrum IV antibiotics immediately. Rationale. Suspected septic shock in an immunocompromised client requires immediate antibiotic therapy to prevent rapid deterioration. Question 33. A client with Hodgkin lymphoma develops painless cervical lymphadenopathy, night sweats, and unexplained weight loss. Which diagnostic test confirms the diagnosis? A. Complete blood count. B. Lymph node biopsy. C. Chest X-ray. D. Serum electrolyte panel. Answer. B. Lymph node biopsy. Rationale. Definitive diagnosis of lymphoma requires histological confirmation via biopsy. Question 34. A client receiving fluorouracil F5U develops severe stomatitis and diarrhea. Which laboratory finding requires immediate attention? A. Elevated white blood cell count. B. Decreased platelet count. C. Elevated creatinine. D. Neutropenia. Answer. D. Neutropenia. Rationale. Severe neutropenia significantly increases infection risk and requires urgent intervention. Question 35. A client with liver metastases develops jaundice, ascites, and elevated liver enzymes. Which nursing intervention is most appropriate? A. Encourage high sodium diet. B. Monitor abdominal girth and fluid status. C. Restrict protein intake completely. D. Promote vigorous physical activity. Answer. B. Monitor abdominal girth and fluid status. Rationale. Ascites requires close monitoring for fluid accumulation and complications. Question 36. A client receiving chemotherapy reports extreme fatigue and shortness of breath on exertion. Hemoglobin is 7.5 grams per deciliter. Which treatment does the nurse anticipate? A. Platelet transfusion. B. Packed red blood cell transfusion. C. Antibiotic therapy. D. Diuretic administration. Answer. B. Packed red blood cell transfusion. Rationale. Symptomatic anemia requires transfusion to improve oxygen delivery. Question 37. A client with cancer is prescribed granulocyte colony stimulating factor, GCSF. What is the primary purpose of this therapy? A. Increase platelet production. B. Stimulate red blood cell formation. C. Increase neutrophil production. D. Reduce tumor size directly. Answer. C. Increase neutrophil production. Rationale. GCSF reduces infection risk by stimulating neutrophil recovery after chemotherapy. Question 38. A client receiving radiation therapy develops erythema and skin breakdown at the treatment site. Which nursing intervention is most appropriate? A. Apply perfumed lotion. B. Use mild soap and avoid irritation to the area. C. Expose area to direct sunlight. D. Scrub the area vigorously. Answer. B. Use mild soap and avoid irritation to the area. Rationale. Radiation dermatitis requires gentle care to prevent further skin damage. Question 39. A client with leukemia develops severe headache, blurred vision, and epistaxis. Laboratory results show a white blood cell count of 150,000 per millimeter cubed. Which complication should the nurse suspect? A. Tumor lysis syndrome. B. Hyperleukocytosis or leukostasis. C. Disseminated intravascular coagulation. D. Anemia. Answer. B. Hyperleukocytosis, leukostasis. Rationale. Extremely high WBC counts can impair circulation, leading to neurological and respiratory symptoms. Question 40. A client receiving chemotherapy develops painful urination, urgency, and frequency without bacterial infection. Which condition is most likely? A. Urinary tract infection. B. Interstitial cystitis. C. Chemotherapy-induced cystitis. D. Kidney stones. Answer. C. Chemotherapy-induced cystitis. Rationale. Certain chemotherapeutic agents irritate the bladder, causing sterile cystitis. Question 41. A client with advanced gastric cancer suddenly develops hematemesis, hypotension, tachycardia, and cool, clammy skin. Which action is the nurse's priority? A. Administer antiemetics. B. Initiate large-bore IV access and begin fluid resuscitation. C. Provide oral fluids. D. Place the client in a sitting position only. Answer. B. Initiate large-bore IV access and begin fluid resuscitation. Rationale. Acute gastrointestinal hemorrhage with signs of shock requires immediate volume resuscitation to maintain perfusion. Question 42. A client receiving chemotherapy develops severe neutropenia and is placed on protective precautions. Which nursing action is most appropriate? A. Allow fresh flowers in the room. B. Perform strict hand hygiene before all contact. C. Encourage raw fruit consumption. D. Limit visitor restrictions. Answer. B. Perform strict hand hygiene before all contact. Rationale. Hand hygiene is the most effective way to prevent infection in immunocompromised patients. Question 43. A client with a history of breast cancer presents with new onset seizures. Which complication should the nurse suspect? A. Hypercalcemia. B. Brain metastases. C. Tumor lysis syndrome. D. Spinal cord compression. Answer. B. Brain metastases. Rationale. New neurologic symptoms in a cancer patient strongly suggest metastatic spread to the brain. Question 44. A client receiving chemotherapy reports persistent fatigue, dizziness, and palpitations. Laboratory results reveal pancytopenia. Which intervention is most appropriate? A. Encourage high-intensity exercise. B. Implement infection and bleeding precautions. C. Provide high-sodium diet. D. Restrict fluid intake. Answer. B. Implement infection and bleeding precautions. Rationale. Pancytopenia increases risk for infection, anemia, and bleeding. Protective measures are essential. Question 45. A client with esophageal cancer is unable to swallow and is at high risk for aspiration. Which intervention is the nurse's priority? A. Encourage oral feeding. B. Maintain the client in an upright position during and after feeding. C. Provide large meals. D. Restrict fluid intake. Answer. B. Maintain the client in an upright position during and after feeding. Rationale. Positioning reduces aspiration risk in clients with impaired swallowing. Question 46. A client receiving chemotherapy develops severe nausea unrelieved by first-line antiemetics. Which class of medication should the nurse anticipate next? A. Benzodiazepines. B. Corticosteroids. C. Antihypertensives. D. Diuretics. Answer: B. Corticosteroids. Rationale: corticosteroids are commonly added to enhance antiemetic regimens in refractory cases. Question 47. A client with multiple myeloma develops worsening renal function and elevated creatinine levels. Which intervention is most appropriate? A. Restrict fluids. B. Encourage aggressive hydration. C. Increase calcium intake. D. Administer nephrotoxic drugs. Answer: B. Encourage aggressive hydration. Rationale: hydration helps prevent and manage renal damage caused by light chain deposition. Question 48. A client receiving chemotherapy develops extravasation of a vesicant drug. After stopping the infusion, which is the next priority action? A. Flush the IV line. B. Administer the appropriate antidote. C. Remove the IV catheter immediately without intervention. D. Apply pressure to the site. Answer: B. Administer the appropriate antidote. Rationale: prompt antidote administration minimizes tissue damage after extravasation. Question 49. A client with cancer develops persistent hiccups, confusion, and headache. Laboratory results show sodium of 120 milliequivalents per liter. Which condition is most likely? A. Hypercalcemia. B. SIADH. C. Tumor lysis syndrome. D. Hypokalemia. Answer: B. SIADH. Rationale: hyponatremia with neurologic symptoms in cancer patients often indicates SIADH. Question 50. A client with terminal cancer expresses a desire to discontinue aggressive treatment and focus on comfort care. Which nursing response is most appropriate? A. Encourage continuation of curative treatment. B. Support the client's decision and discuss palliative care options. C. Ignore the statement. D. Advise family to make decisions instead. Answer: B. Support the client's decision and discuss palliative care options. Rationale: respect for autonomy and transition to palliative care ensures quality of life and patient-centered care. Thanks for completing this intense oncology quiz. Make sure to subscribe to the channel so you never miss high-level NCLEX questions that test your clinical mastery.